Good day, great members of Hive community. I go by the name Sami Med, and today I'll be talking about dangers of poor diabetic mellitus management. But before I go into the topic, let me say something briefly about the hospital management of diabetes mellitus. My last video, I spoke about the home management of this condition. So today, briefly, the hospital management of this condition is not far different from the one at home. Just that this time around, you have more health personnel taking care of you. In case of diabetic foot ulcer and other things, you have health personnel dressing it to you, close monitoring and all. That's just something different. And then you might have fluid therapy even at home, right? But in the hospital, you might be placed on fluid therapy, normal saline, or ringer's lactate, as the case might be. So with this, let me go straight to the topic of today. Now, what happens if diabetes is not managed properly? Now, if you fail to manage diabetes properly, you expect one, heart attack or heart condition. You can also experience stroke. Now, why will you experience heart attack and stroke? This is because of the condition, blood vessels will be narrowed, and that will not allow the good flow of blood to any part of the body, especially the brain. And because of that, you might end up developing stroke, or because the heart now will be working very hard in order to keep up to the demand, despite the fact that the blood vessels are being narrowed. So because of that, your heart will also develop an issue. Another thing also is that you can have eye blindness. Why? Because this sugar, this glucose now have affect the nerves or part of the eye that you will be unable to see. So because of that, diabetes mellitus, if you manage it poorly, you can have eye or blurred vision. The problem. Now, you can also have what we call diabetic neuropathy. This is the damage to the nerves of your body, especially the lower extremities, your feet, your hands. Now, when somebody have this condition, this poor management, you discover that even if you touch their feet, they might not even experience pain or anything there. Okay, that's because of the condition. Then you can have poor wound healing. You have a cut either at your hand, your feet. You discover that it will take time. Some might not even heal. Some might be a lifetime dressing, cleaning of that wound. Okay, I don't know if you are understanding it. Now, we have a lot of conditions, a lot of complications that can arise if diabetes is not managed well. The last one that I would like to mention apart from the rest is death. If diabetes is not managed well, it can lead to death of an individual. So because of this little complication, remember I said we have more than them. We have plenty more than what I've listed. So because of this, please and please, if you know anybody who has diabetes mellitus, or you have diabetes mellitus, don't take your treatment, don't take your management for granted. Stay healthy, stay wise, and stay knowledgeable enough. Thank you very much.